Officials of the Ministry of Health, Department of Immigration, and other allied government authorities are assuring the general public that there is no need to panic over the novel coronavirus as extensive precautions have been undertaken. In a press conference held at government headquarters on 3rd February 2020, authorities made detailed presentations on preventative measures being undertaken in St. Kitts and Nevis. Chief Medical Officer Dr. Hazel Laws said the situation is actively being monitored.
The health team within St. Kitts and Nevis stands ready to identify, isolate, and manage suspected cases of this new viral infection. I repeat, the health team in the Federation of St. Kitts and Nevis stands ready to identify, isolate, and manage suspected cases of this new viral infection. The National St. Kitts and Nevis International Health Regulations Committee within the Federal Office of our Ministry of Health continues to monitor this outbreak closely, hour by hour, minute by minute. The health desk at the R.L. Bracher International Airport is covered by nurses and our environmental health officers, and St. Kitts and Nevis issued a travel advisory which was announced on Saturday, February the 1st. The travel advisory speaks to citizens and residents being advised to restrict travel to China until the World Health Organization gives the all clear in relation to the novel coronavirus. Persons who have trips planned to China, we are asking you to postpone same. Persons traveling from China or who have traveled to another country from China en route to the Federation within the last 14-day window period, we are asking you to remain where you are and not to travel to the Federation. Persons who travel to St. Kitts and Nevis from China at this time shall be subjected to screening at our ports of entry and may, if necessary, have their movements restricted.
Meanwhile, Chief Immigration Officer Ms. Mercelyn Hughes outlined the active protocols in collaboration with the health teams at the A and seaports being used for passengers entering the Federation.
We have a very robust system as well, the Advanced Passenger Information System, that will give us information, whether it's on the form or not, but it will speed up the process if persons would adhere to number 17 and give us that information. But in collaboration with the JRCC, the Joint Regional Communication Center in Barbados, that has responsibility to receive all information on passengers and vessels and entering the Federation. We have that information readily available just in the event that we need to do a secondary on a passenger. If we have suspicion that somebody may not be telling the truth, there's the avenue that we can use to verify. The nurses, the help desk at the airport is very comforting and it's very reassuring to us to know that they're right there and they themselves assist with the screening of passengers. They don't have to sit in the office. They're not sitting in the office waiting for us to come and knock and say, we have a suspicious case. They're right there on the floor. So they themselves can observe and see whether or not they're passengers who they may want us to direct to them as well. So it is a very, very concerted effort. It is the partnership is strong. And I must commend Dr. Laws and all the doctors and nurses who have been working so closely with immigration and customs to ensure that our Federation remains safe. We are the gatekeepers. We're the ones who let people in and we let them out, and we want to ensure that our Federation is safe.
Passengers arriving in the Federation must complete number 17 on the immigration form that indicates visits to China or affected regions, which is then cross-checked with other protocols. The Federation is also receiving strong support from the Caribbean Public Health Agency, the Pan American Health Organization, and the World Health Organization. Glenn Barth for SKN Newsline.